Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
And of course, my niece's was 400, and she raised the thought that that's probably genetically in our family and in our heritage, and it may be in yours as well. The difference is that for LPA, um, you there's nothing you can really do to lower the LPA. For the HDL and the LDL, there are medications you can take to address those. But for LPA, if you got a high LPA, so far, we don't really have a way of identifying a way to lower the LPA, but they recommend that everyone once in your lifetime should have an LPA to find out whether or not uh, your family has that heritage of having uh, high LPAs, and if you do, then they want you to try to keep your blood pressure normalized, to make sure you don't smoke and decrease the amount of alcohol you drink, if eliminate altogether, and have a healthy lifestyle. Eat more plants, vegetables, and fruits, and less meat. And that's the advice for the families in which you have a high LPA. But that is something that most doctors do not get, and something that you might, when you get your annual physical, ask the doctor to get an LPA to find out what your family tree is like with this. And then if it's elevated, then you just uh, realize how important it is to adopt a healthy lifestyle, exercise, meditate, and all those good things. So, any comments or questions about this hidden risk factor for heart disease?
What is it again? What is the LPA?
That's it. It's an LPA. That's the name of it. Alpha lipoprotein. LPA. Alpha lipoprotein. It's a specific type of cholesterol that is different from the HDL and the LDL. So you might ask your doctor to get one for you if you get your annual physical and blood testing, to see if your family has a history of having, and then if you have have a lot of family members who die of strokes or heart attacks, then you can recognize that that is something that's in your family tree. Any of you ever have an LPA done? If not, consider getting it done. And of course, if you adopt a healthy lifestyle, anyway, I guess it doesn't really matter because there's nothing else you can do right now. They don't have a specific way of decreasing the LPA if it is elevated. Unlike the HDL, which is good if it's high, and the LDL, if it's over 200, then you can take medications that can lower the cholesterol.
I remember seeing it. It could have been on my physical uh, survey. I mean,
Yeah,
they
it's
do
unusual
all.
if it is. You usually have to ask for it because most doctors wouldn't do it. A cardiologist might do it, but because there's no way of lowering it, they may not do it either unless you specifically ask for it.
So if you found that your LPA was elevated, there's nothing you can do except be physical, get
Except
exercise.
for except the things that we talk about on this program, the meditation, exercise, and healthy lifestyle. Yeah.
Okay.
Okay, that's the probably the next article that was interesting is uh, an article that talked about fast walkers uh, have less Alzheimer's, have less brain, less cognitive decline than anybody else, and so the faster you walk, the less likely are you to have Alzheimer's or any condition that's going to decrease your cognition. And so they didn't say what rate you should walk, but they did say that they tested thousands of patients and found that those patients who walked faster had uh, longer lifestyle, longer lifespan, as well as uh, healthier brains. And so the faster you walk, the more likely you are to live longer and uh, not get Alzheimer's. They don't actually identify what rate that is that makes you a super mover, as they call it. But they do indicate that those who walk faster uh, have less brain decline and less Alzheimer's than anybody else, and they live longer. The next article that I thought was of interest is uh, they talk about brain fog and how uh, there are conditions that cause your brain not to be as receptive for activity as other things. And they talked about sleep apnea as a cause, menopause as a cause, long COVID as a cause, uh, GI, gastrointestinal diseases, sleep apnea, not surprisingly, as a cause, chronic pain as a cause, and then I think it was mentioned last week by somebody, vitamin B12 as a cause for brain fog. Brain fog is a term that means that you aren't able to think as clearly, as rapidly as you used to. And so they just recommend that if you're aware of fact that your brain kind of slows down and you have any of these conditions, it's something to talk to your doctor about. And then I talk about how breathing, and of course, those who do yoga uh, would be quite aware of the fact that breathing really does help with stress, and that whether you uh, identify which type of breathing that you favor, because there are different types of breathing, whether it's diaphragmatic breathing, uh, but uh, breathing does work, and there's much data that indicates that those who actually spend time alternating in breathing efforts, that it does make a difference. It helps with stress, and it helps uh, with mental health as well. Uh, and I think then there's a very interesting article. We had an episode of cyclosporiasis, which is the parasite which causes GI diarrhea, and we had an epidemic of that just recently. And they talk about how that one of the problems is that they take sewage water and they water the plants with it. And this may well be sometimes reason why you have these periodic epidemics. I know. Uh, so it is just an article that indicates that they actually have treated the sewage, that is the uh, what what comes out of your toilet, and they treat it, but it isn't always 100% effective. And uh, since they use this to water the plants and the foods that you're going to eat, this may be one of the sources of cyclosporiasis, which grows in the feces of us and is eliminated with our bowel movements. And then when they take the sewage and treat it, it isn't always 100% effective, and as a consequence, these epidemics may occur. Fortunately, I think in this recent episode, only two people died, and almost everybody was able to be treated with a sulfa drug. But as Gina had mentioned, if you're allergic to sulfa, there's really not a whole lot of other drugs that are very effective against this parasite. But it's good to know that there is an effective treatment. But if you're allergic to sulfa drugs, then this can be a problem.
Dr. Callender, um, I think there's a suggestion that's ciprofloxacin can be used as an
That's one
alternative.
of the drugs, but it's just not.
Yeah,
It's not as good as, of course,
right, right.
Bactrim. But they mentioned that in another drug as well. But um, they also mentioned that many people who think they're allergic to sulfa drugs aren't, but because the effectiveness of Bactrim is close to 100%, the effectiveness of ciprofloxacin and other drugs is far below that. So that's the concern that they have. Any other comments about that? And I guess uh, we can go into our articles. We have a lot of them today.
I had a question, Carol, are we recording?
It
I'm
said
not, Darryl, are you
recording.
recording?
It says recording.
Okay,
Okay,
good.
Yes, I'm recording.
Thank
All
you.
This is a very good article and very timely because uh, COVID is rearing its ugly head again, and the flu season is not here yet. But and most recommendations are that you wait until actually the end of September before you take your flu shot. But the new flu shot, we'll go back to that first article, the new flu shot. Yeah, because it's apparently more effective. We kind of mentioned it last week, but uh, this article goes into more detail about the importance of the mRNA technology and why it's good and why this mRNA technology, unfortunately, is associated with more side effects. As those of you who got the COVID, which is mRNA, will remember, you had more side effects from the mRNA than you did from the traditional flu shot. And that will be true of this mRNA flu shot as well, that you would have more side effects. But you would have the ability to change the vaccine and make it more effective if you find out that it's not as good as you want it to be. And this would allow you to change in midstream, which you couldn't do with the other vaccine. Dr. Perez, you had a question, comment.
Yes, when you say mRNA, I know it just came out this morning about the impact of using this vaccine against melanoma.
And that's
Uh,
different. That's a different vaccine.
I know it's different, but it's still with mRNA.
Right. Mhm.
Just how this has just exploded, given the resources available during COVID. So it's just very exciting and hearing this.
Well, it's kind of frightening because you realize that Trump tried to block this.
Absolutely. Vote.
But the point is that you've got an executive officer who thinks he knows everything and actually knows little and is trying to run everything nonetheless. And at the beginning of the of his tour, he wanted to effectively stop mRNA. Uh, and, uh, and as you say, the studies are showing that it's an invaluable tool and a very incredible scientific advance, which we're just probably finding out the tip of the iceberg in terms of how effective these mRNA vaccines can be.
And I have to call out, the contempt charge on Fauci, who was a major advocate not only for mRNA in COVID, but also as it related to HIV disease. And so we got to vote.
Well, Trump is, and the Republicans are after him. So, I mean, they would have had him in jail if Biden didn't protect him already. But Tony Fauci is a target for them because they couldn't get Biden, so they want to get Fauci. And you're right. This is unfortunate, but that's how Trump is, though. Uh, he's vengeance is mine, I shall repay, is what seems to move him uh, so far. Anyway, John Buchanan.
Yeah, Trump just wants to deflect the blame for COVID. He was actually, to blame for COVID spreading
Yeah, no,
to
he tried
begin
to
with.
say
He wants to put it on somebody else. That's all.
that. Yeah, yeah, and he hated Tony Fauci anyway, so they they had different public differences. Yeah, so
And he's a hater. Trump is a hater.
yeah, yeah, that's putting it mildly. Okay, so so around September, late September, October would be the time. I know for COVID, it depends upon every 6 months is still the recommendation for how often you should get your COVID shots. So I know my time for a repeat COVID is probably this week or so. But for the flu is going to be late September, early October. Now you see this article here that Trump Trump now thinks he's the CDC. I see. He signs an order calling for spacing out childhood vaccines, which of course is the antithesis of what the science is saying. But uh, you would think he's a doctor or something, but he's uh, once again bringing up the argument about autism along with Kennedy, which we have no evidence for. And so this is just another example of what we're up against with the Republican Party in control of things. And it's probably likely that things are going to get worse. Yeah. Any comments about the executive order that Trump has had the audacity to put in place? No comments? Okay.
We- I think it's important that we know about it and we share the information because it's gonna soon become um, those vaccines that are approved in this schedule to be paid for, and those that are not will not. And only those people who can afford to pay for it and it not being covered by insurance will get the vaccines. So it's a policy issue that we must stand up against and make sure that our legislators are aware of it. They've got a lot on their plate, but we've got to let them know that childhood immunization is not something that we're going to be quiet about.
Well spoken. Any other comments? Not.
I had a question about that. So, uh, do states fund the vaccinations or is
Yes,
it federal funding?
states do.
Okay, so it doesn't matter, but if you're a red state, you're probably going to follow with Trump, right?
You might. But it's up to states to do so. Yeah.
Okay, so the the state funding might be in question. Is that what we're saying? I'm a little confused.
No, it's
Yeah,
not. It's not that the state funding is an issue. The state, what is at issue is that the insurance companies follow what the rules are, and uh, Trump is suggesting that we break up MMR, mumps, measles, and
Rebella.
rubella, and uh, therefore, as Lucy is saying, those if insurance doesn't cover it, that means you have to pay for it yourself. And those people who don't have funds will wind up not being able to get the three vaccines. And that is where the problem lies. If insurance doesn't pay for it, and if your state does not fund it, then the rich will get richer and get vaccines, and the poor will not get vaccines. And that's something that we should avoid. And it all goes back to the Obama care. Uh, uh, Trump has never forgiven Obamacare for taking off and doing such a great thing. And his every action is to eliminate it from wherever he can find it.
Yeah, I saw a little snippet of Trump behind his desk saying that getting those multiple vaccinations at the same time. He compared it to uh, like a large amount of vaccines coming in, like gallons. He's scaring people with that concept, with that idea of a whole lot of drugs being put into you, and it's no more than any other vaccine that you ever get.
Yeah,
As far as
and unfortunately, he's very influential, and people will follow his recommendations, unfortunately. Dr. Perez?
It has taken us decades to educate people to come in to get all three vaccines at the same time. We're talking about people because of what we did as it relates to public assistance, the least able to take time to go and get your children vaccinated. That's why we had all three come together. It is the antithesis of what the research talks about. I mean, it's like I am, Earth one and Earth two.
So true, so true. Any other comments? Okay, as you said, we have to get out and vote. Okay. This article is very timely because, as I mentioned, every 6 months you need to get a COVID vaccine. And so if you haven't gotten the vaccine in 6 months, it's time to re-up because that's the science has said that it should be every 6 months. Mark Tatum?
Yes. Have you guys discussed the recent hearings of Dr. Fauci and his walking back of his statements or whatever he was saying?
No, we did not discuss Fauci, but did you have a comment to make about it?
So I'll be right back. I'm gonna do my research on that. But basically, Dr. Fauci was walking back his statements about the
No,
importance of.
Fauci did not respond to any questions on the grounds of that he self incrimination.
They asked him, I believe, about his tie, and he refused to respond.
Right. He didn't respond to anything, really. That's why they're holding him in contempt of court.
Okay, yeah. So I thought it was, somewhat related to what we're talking about now with, vaccinations and
Well,
the,
it's related. Every question they asked him, he had the same answer.
yeah. So it just makes me look sideways at his character and him being the proponent of a lot of this kind of makes me question a little bit about, what's going on I mean, we already know what's going on in the world today, but I just felt like it was related. So I just brought that up real quick.
Yeah, we did not discuss that actually, but
Yeah, don't look sideways as his character. It was it was necessary legally because they wanted to take any difference in prior statements and his Senate testimony as a reason for charging him with perjury. So he was only trying to protect himself.
yeah,
Got it.
his lawyer advised him that they were coming for him and that his best response was not to respond. And but we really haven't discussed his situation, which is very interesting because it's a political battle that the Republicans have against Fauci, which they have always had against uh, John Buchanan.
Yeah, I just saw a commercial this morning about this new pill, and it says if you've been exposed to someone who tested positive for COVID, you could take this Absoba uh, ox. I forgot how to pronounce it.
Okay.
Excova pill,
Mm,
and it could protect you if you get it within 3 days of the exposure.
okay. Thank you for sharing. Yeah. Any other comments about COVID and the need to get it every 6 months? For now, at least that's the recommendation.
I hope there is something other than Paxlovid. That even though that was very effective, it's a nasty a nasty pill. It makes you feel like you're eating metal. Sorry about that, but it worked.
Yeah. Okay, let's go to the next article then. This is an interesting article about taking insulin just once a week for people who have type 2 diabetes. Uh, this is a new thing that has been FDA approved. Most people take insulin at least once a day now for certain categories of type 2 diabetes. They actually have it now once a week, which is an interesting, which is not available for type 1 diabetes, but for type 2 diabetes, it is. Because type 2 is usually a milder type of diabetes, which doesn't require as much uh, insulin in many instances if you adopt the other lifestyle changes that are recommended, losing weight and other things. Any comments about this, which is very interesting FDA approval of a once weekly uh, basal insulin, which is novel. Dr. Perez?
For a policy issue, a very good friend of mine got kicked off of their supplemental Part D insurance. So that's the pharmacy. And they had been on Jardiance and uh, uh, I don't remember the other drug, but because they could no longer afford it, their insurance was not going to cover it. They put them back on long-acting insulin,
Oh,
and but then many of the other things that we use, such as CG, the continuous glucose monitoring, and things like that, then have to be part of the package, which insurance would cover. So I would be very interested in the outcome long term, because it almost seems like we know that something has been more effective with a drug that is still trademark as opposed to generic. And now to begin to bring in this pattern without long-term follow-up on the effect of using insulin in this manner. Do you follow what I'm saying? It almost seems that as if we will have two standards of care, one which would be baseline and one which would be more effective. And again, will we pay for the cheaper product versus the more effective one? And that's just a comment because um, I saw it play out for a dear friend based upon insurance.
thanks for sharing. Any other comments? Um, so as a friend of mine, Curtis Yeager used to say, the further we go, the behinder we get. And sometimes we take a step forward and go backwards instead of forwards in terms of recognizing that sometimes when you have health care that allows the rich to get richer and the poor to get poorer, that this is the antithesis of what we're trying to accomplish. And that I think is your point. Okay, any other comments?
Dr. Callender, you've used that expression, rich to get richer and poor to get poorer. Can I add a variation? The rich to get richer and the poor to get sicker.
Okay.
Just a
Thank
little
you.
nugget.
Absolutely, because how many times have we talked about the benefits of GLP-1s?
Hmm.
But now we're going to refocus our attention in a diabetic on blood sugar when we know that it has a far greater impact on the entire body than just that.
Makes you
Okay.
shake your head.
Any other comments? Okay, we'll go to the next article. We had mentioned that cyclosporiasis actually has only one effective drug, and we'd mentioned that Bactrim is the treatment for the parasite, and it's about 95% protective, but for the patient who is allergic to sulfa drugs, then the options aren't very good. And this article talks about ciprofloxacin and another drug, which aren't nearly as effective, but if you have a sulfa allergy, that's what you're going to have to use. Although there's an argument that uh, rapid hydration and uh, early diagnosis might be enough to adequate hydration might be enough to overcome the negative effects of the diarrhea. But this is a good article that points out that many of the sulfur allergies may not be uh, legitimate allergies. However, uh, all you need is one Stevens-Johnson syndrome, and you you regret it because that can be a fatal reaction to sulfur. But this is a good article that talks about the fact that some of the sulfur allergies are not enough to warrant eliminating the use of sulfur drugs, which is by far the most effective treatment for this disease. Stevens-Johnson syndrome can be a fatal cutaneous reaction to any drug that you're allergic to, whether it's sulfur drugs or penicillin. And it also occurs with other medications as well. Any comments about this article? Any of you allergic to sulfur drugs? Okay, well, let's go to the next article. This is a kind of a little disturbing article, although we're getting more and more articles like this that identify, for example, last week there was an article that suggested that patients on GLP drugs and insulin, they don't get tweaked and they don't get monitored like they should be. And this is saying older diabetics don't don't get medication tweaks if their hemoglobin A1C, let's say, is 8 or 9, and when we know it should be down to be 6 or 7. And looking at the records, they're suggesting that older diabetics are ignored and they aren't tweaked. And this goes back to one of the comments that Dr. Perez made about the glucose monitoring, because uh, with glucose monitoring, you would be better able to tweak and optimize the hemoglobin A1C and the nomoglycemia. And this is something that if you have hypertension or diabetes and they're not optimized, then these conditions can cause other complications that are avoidable. And so uh, keeping your blood pressure under control and your blood sugar normalized are ways of keeping your health under control. And this article is alleging that for older patients, we aren't monitoring them like we should be. Any comments or questions about this? Is somebody trying to speak up or no? Okay, well,
Yes.
Betty, were you trying to say something? No, no. Okay.
I had started to say something. Good morning, everyone. I had started to say something, but just thinking about the monitoring of patients. Well, my husband isn't on insulin. He is a diabetic, but he is not on insulin. He's just on the pills. But his doctor, his doctor does monitor him quite regularly, and so he's in that older category. But she does monitor him
Good,
regular
good,
basis.
good.
Yeah.
Good to hear. Good to hear. Okay. This is another article that talks about light exercise lowers the stroke risk for patients with AFib. AFib, as we've seen articles recently that indicate that smoking and drinking increase the likelihood of stroke for patients with AFib. And this article now says that light exercise allows them to live longer if they adopt the healthier lifestyle. And they're talking about studying 87,000 adults. So that's a pretty significant number of patients. So if you've got AFib, and then light exercise is the thing to do. And of course, walking for 30 minutes a day, 5 days a week is kind of the minimum of what you'd want to. That's the category of kind of light exercise. And it's something that pays off in a longer life and not getting a stroke or heart attack.
Um, Dr. Callender and the panel, I just wanted to share with you that my brother-in-law just this morning in Massachusetts received his second cardioversion for AFib. He had AFib that was really, really stubborn. He had had 3 attempts with cardioversion to correct it, and they put him on a beta blocker, and I suppose gave him other advice as well. And today it was successful with one try. So that means he no longer has the arrhythmia, but it can come back. But for now, we are less worried. Just wanted to share that with the group.
Good news. Good news.
Thank you.
Joyce, you had a comment?
Yes, I just came back from visiting my aunt in South Carolina, and she's 89 years old. And one of the things that she has continued to do throughout her life was to go to the gym. And she said when we left on yesterday, she was getting herself ready to go to the gym. And she is in very good health. She has very good health, and her spirits are high, and her thinking capabilities are very, very good. So I just wanted to say that, yes, some form of exercising as you age is very beneficial to your whole body makeup.
Thank you for sharing. Okay. All right. Let's go to the next article then. It's an interesting article about eggs and the impact upon your liver. And it seems as though eggs are a popular breakfast item and one that is good for the liver for the most part. Although the fact that it has vitamin B12 is uh, not is appreciated in that eggs and liver health can be a good thing, but if you already have liver disease, it can also be complicated. But it does appear as though that the uh, eggs are good for you, uh, and not in the generally in the category of a food that would negatively affect the liver uh, in general. Although there are circumstances where if you have uh, uh, liver liver failure, then that's another story. Although we now have GLP-1 drugs that reverse the previously reversible liver disease. So we're making progress in an area that we didn't have progress before. And the bottom line is that in general, eggs are good for you, and that while it has cholesterol, it is still a healthy breakfast item. And unless you have um, MESLD, which is the liver disease that uh, now we can reverse the GLP drugs, which in the past would automatically go on to give you end-stage liver disease and require a liver transplant. But we now have at least a treatment for it, which we didn't have before, because it would cause uh, fibrosis, which would lead to liver death. But they're suggesting that eggs are not bad for the liver in general, but if you have liver disease, that you could cut back on it. Many of you eat eggs for breakfast? Yeah, so looks like it's good to have.
They were saying, bacon and eggs, sausage and eggs, steak and eggs. Those are more problematic, but the eggs themselves aren't that bad. I have breakfast like that maybe once a week, so I I'm pretty okay, I guess. Thank
Thanks for sharing, John. Okay. This is an article that kind of repeats, pointing out that smoking, diabetes, and high blood pressure uh, are associated with nearly 13 years, if you can avoid those, 30 years free of dementia. So that normalizing your blood sugar, your hypertension, and eliminating smoking will get you 13 more years of dementia-free living, which is desirable. So, but the real key is that uh, stop smoking, control your blood pressure, because if you have high blood pressure and you don't control it, it doesn't matter. And if you have diabetes and your blood sugar is not controlled, then that's not good either. So doing that will keep you in control, likely to keep you free of dementia. So sharing that, I think, is important to share again. Any comments or questions about that? As we we see patients uh, who are on blood pressure medications, but they don't take them. Uh, that doesn't help. Just because you got to take your medication and you got to monitor your blood sugar and your blood pressure and make sure that your blood pressure stays under control, because that's the key to surviving. Same thing is true for uh, your blood sugars. And that's why there's so much talk about monitoring blood sugars and hemoglobin A1Cs. And we'd all like to be dementia free, so I think it's good to reemphasize the importance. Any comments or questions about this? And of course, we have a lot more dementia than we'd like to have, so this is particularly important for us. Any comments or questions or concerns about this information?
Dr. Callender, what is the APOE epsilon
That's
for?
a genetic finding that people who have that genetic makeup are more likely to have dementia. And so that's a genetic test that they do. And they found that that genetic makeup is more common in patients who develop dementia. And so for that particular category of patients, it is even more important to have your blood blood sugar and blood pressure normalized and eliminate alcohol and smoking. Okay, so education is power, so we're educating and informing so we can take the actions that are necessary. Any other comments or questions about this very important article? This is the next, remember we had an article last week that talked about combining Aleve with Tylenol to offer acute pain relief. Now we have another medication that also does the same thing. So we're talking about additional ways of avoiding the use of opioid medications after surgical intervention, and so that we can decrease the number of drug addicts that we produce as a consequence of surgical intervention. And so we're getting more and more FDA approved non-opioid pain relievers. Any comments about this? This is a very important developments that we hope will decrease the number of drug addicts we have in communities.
Dr. Callender, what is that abdominoplasty?
Abdominoplasty is any surgery on the abdomen. This can be done for a number of reasons, but any surgery on the abdomen is an abdominoplasty, whether it's for hernia or whatever. So that's what that refers to. And not infrequently, it can be cosmetic, or it can be for hernia, or for any surgery that involves operating on the abdominal cavity. So this is progress, I think. So we as uh, physicians need to try to avoid or decrease the amount of uh, opioids we use in our postoperative patients. Any comments about this? I don't think this is the key to decreasing the number of addicts, but it's certainly a step in the effort to decrease the number of addicts. We have so many people who are addicted to drugs and are on medications to keep them from that addiction, which is overdosing is still killing a significant number of people. Any other comments about this?
Yes, I really am a person who really does not like taking drugs, so it's just nice to know that they're trying to make them safer for us if we have to take them. 'Cause,
Right, I think it's very good.
yeah, I hate to.
Okay, well, let's go to the next article then. This is an interesting article. It talks about uh, BRCA, which is a test that they use to try to find out what kind of breast cancer you have. And if you have this gene, then there's a special uh, medications that can be used to delay the recurrence of breast cancer. And since breast cancer is killing so many of our Black women, uh, uh, getting this genetic test is no longer a luxury. It's kind of mandatory so that you can get the optimal treatment that is likely associated with a longer life and fewer recurrences once you make the diagnosis of breast cancer. It used to be that BRCA was optional. Now it's pretty mandatory that as soon as you get a diagnosis made, that you get gene testing to find out whether you're BRCA positive or negative. So you can take the medications that are most likely to be associated with a longer life after breast cancer. We talked last week also about when you have a genetic testing that shows that you have BRCA, that some people even go as far as getting uh, preventive mastectomies and preventive oophorectomies, but that's another story. But this is really talking about once you make the diagnosis, to implement treatment that would uh, prevent the disease from recurring, which will make a big difference if you're BRCA positive. I think most of us have relatives who have had breast cancer, and so we are all aware of the importance of getting the diagnosis made and also getting treatment as soon as possible. Any comments about this? If not, and this part talks about how physical exercise is an important part of post-cancer therapy. Um, it's almost in every aspect of life. Physical exercise is an important part. And I guess the moral of the story is after 40, exercise becomes mandatory if you want to live a long life. Okay, if there's no comments, we'll go to the next article. This is a shocking article to me that living near a dry cleaner increased the risk for Parkinson's disease. Not something that I was aware of before I read this article, that living close to dry cleaner mattered. And of course, we know that where you live, what your zip code is, determines how long you live. But the proximity to a dry cleaner and the contamination that goes along with it predisposes you to Parkinson's disease. You don't see as much of it in Parkinson's disease in our community as I see in the white population, but it still is, and it's thought to be related to the dry cleaning solvent. So, but I think it's another way in which where we lived determines our lifespan, and how we were, what residence we were placed in determined our lifespan. Yeah. So, any comments about this disturbing article?
Yeah, makes you wonder about people who work at dry cleaning establishments.
Right. Yeah, that.
What a high risk they have.
Yeah, they are. Yeah.
Also, whether it stays in your clothing.
Yeah, it does.
Right.
Yeah, we've seen articles that identified that as well. Yeah. So, but living close to them is an even greater risk. Yeah. Amazing.
Yep.
Your geography is so important, and through the decades we've been put in residences and locations that were destined to decrease our longevities. And this is no mistake. It was planned.
Dr. Callender, I wondered what was the motivation to check this out? How did that idea come up? That there could be a relationship between dry cleaning and Parkinson's.
Darryl, any comment?
DEI.
Yeah, DEI. My my comment is I was just doing a internet research and it said traditional dry cleaning chemicals are dangerous, while wearing dry clean clothes poses a low risk. Workers in the environment face high risk. So living next to a dry cleaners or working in a dry cleaning store is a major risk. But just wearing dry clean clothes poses a low risk, but that doesn't say no risk. So there are some alternatives to dry cleaning, which can be steam cleaning. You can get a steamer from Amazon. I think my steamer costs about $80, but you it you have to steam it a while if you've got bacteria odor in your clothes because you sweated. You're going to have to steam it more than you think to remove the odor. But getting out the wrinkles is very effective using a steamer. I got mine with a hanger, and so that you can hang your clothes on it. Even it'll work for long clothes. If it's a dress, a pair of pants, very effective for steaming. It's got a device in it that you can use for creases if you're using it for pants. So it is a fairly good alternative to dry cleaning.
Thank you.
Sounds wonderful.
Lucy?
It's important for us also to be on planning boards. I know they just built something, a grocery store and basically a mall that people were fighting against 20 years ago. But it is important for us to be in planning boards so that we make sure that our communities are free of these things that we now know will be destructive to us. And if our voices aren't heard on them, again, vote, vote, vote. But if we're not there and we don't raise these issues, then we will continue to de- be disproportionately impacted by its impact. Data centers, we know, how many of us are at the tables making those decisions.
Thank you for sharing. Gina, did you have something you wanted to say?
I just wanted to say thank you to Darryl for his suggestion. I think I'm going to uh, start doing that because many times you send things to the cleaners because you're not sure that your traditional ways of cleaning clothes, washing, etc., is going to destroy something on the clothes. Or, um, if hot water is not good, if your machine's not good, hand washing may be an option, but many times it's not. So thank you, Darryl.
You're welcome. I've got another comment. The primary danger of dry cleaning, bring it into your homes, is the plastic bag. The
Haha,
thin, transparent polyethylene covers used to protect the garments, but you don't want to hang them up in your home. You remove them immediately. If I do get some dry cleaning, I take the bag off and put it in the trash before I even take my cleaning into the house. Leaving
ah,
the clothes in the plastic bags, it traps moisture and residual cleaning solvents, which can cause yellowing, mildew, or fabric damage. So get rid of the bag. Don't bring it into the house.
probably holds the chemicals in it too.
Yeah, that's what I just said. It holds the
Right,
residual
right,
cleaning solvents in the
right.
dry cleaning bag.
Yeah,
So I remove mine. I keep my garbage cans in the garage. The bags never go in the house.
Okay.
perfect. Thank you.
Thank you for sharing. Any other comments? If not, let's go to the next one. This is an interesting one that says that if doctors tell their patients that their symptoms are normal, that they are less likely to seek treatment, and that we as physicians have an inclination to say to patients that these symptoms are normal. And when you do something like that, it's something that makes the patient feel that they don't need to worry anymore, and so they don't follow up on things. And so they're trying to induce the physicians to not tell any patients who have symptoms that this is the normal thing to have because it works against them. And in this era in which we recognize that the patient is the center of care, it's important to emphasize their role uh, in determining what kind of treatment they need to have. Uh, the autonomy in patient determining their treatment is something that is becoming more and more uh, important for us to emphasize. And so, not telling patients that this is normal or not is not something. Have a good concert, Darryl. We'll miss you. Okay. Any comments? If not, we'll go to the next article.
Yeah, I had a comment. You know,
Yes.
it's more of you're trying to assuage the feelings of the patient, uh, so they won't worry. But when you do that, and at least in my case, I'm not worried, but I could get sicker as a result of not dealing with whatever it is that they're saying it's normal about. And, maybe it's, I don't know the correct word for it, but doctors are trying to, look out for the patient's feelings, I guess. But that could be dangerous. Well, what do you think about that?
Thanks for sharing. That's a good point.
I'd like to add something here. I think it's more important for clinicians to tell their patients how their results compare to the past ones, or how to look for any changes with testing within the next 3 months or whatever the case is. It's the comparison, I think, that is more important than just passing off a result as normal. It may be normal, but it may be approaching abnormality. It may be has dropped significantly. I think it's the comparison of where you were before and what to look for in the future that's much more important than to just pass off things as being normal.
Very, very good point. Excellent point. Yeah, agree with you. Thank you for sharing. Okay, let's go to the next article. This is an interesting article that says if you have a genetic risk, Alzheimer's, like the APOE that John asked about, uh, if you have that kind of APOE genetic variant, if your heart is not working well, your brain is apparently shrinking. And so a normal cardiac output, uh, being 50% or higher, is important for your brain to stay uh, so your heart health protects your brain. So it means that as you get older and you have heart problems, that these need to be managed so that your circulation is optimized and your brain stays the same size or grows rather than shrinks. Interesting article because it suggests that people who have that genetic variant have to uh, live healthy lifestyles and do all the things that we talked about in terms of diet and exercise and meditation, etc. Any comments about that? If not, let's go to the next article. This is one about eczema, which is a condition of the skin. And and this article identifies that most of the eczema is associated with contact dermatitis, and more than 70% of the cases, close to 60% of the cases, that is, are related to contact, and uh, which is interesting because this is done in Spain, and whether it's related to what we believe is here in the United States is remains to be seen, but it's interesting. You want to, Mark, want us to go back to the title because you didn't show it. Yeah, occupational triggers half of the chronic eczema, hand eczema. So that, in other words, what you touch, allergic contact, accounts for close to 60% of the cases. So most of the eczema, what they're saying, in this case and study, uh, really is associated with what you touch, what your hands touch. And this study was done in Spain, so whether this is true in United States or not, it's probably true that most of the eczema is related to what you contact. Yeah, and to do this study here in the United States would be interesting to find out if that's the same exposure that you have. Yeah. Betty?
Yes. My first child was, uh, well, I don't know whether he was born with eczema, but he was, it was found out that he was allergic to milk. So I had to give him the alternative formula, which was mull soy or something. I can't remember the name of it now. It's been so long ago. But he from birth he was breaking out, and this is what they came up with. And I he remained that way throughout his life, I believe. I don't remember that he told me he did not have eczema. So I think it remained with him for his entire life. He's deceased now, but yeah. It- and
Yeah, it's an interesting condition. My niece had it, and as she got older, it went away. But it's
yeah, his might have
it,
gone away. I don't really remember, but it wasn't as bad, of course, as it was in the beginning. But as long as he avoided milk, he was pretty okay.
hmm, okay. Thanks for sharing. Okay, go to the next article. Then. This is something that Darryl had talked about often now. Uh, Obesity-related cancer risk is there, and we sometimes tend to ignore it. But this study, which studied thousands of patients, also identified that those patients who we lowered the obesity rate had decreased cancers, which is an interesting observation, very important one. And so that one of the things that we should do and should be doing, as you're talking about 13, close to 13,000 patients was in the study, where they identified that those people who participated in the study who lost weight and worked at it had fewer cancers than others, which suggests that something that we already know, that obesity-related cancers are not uncommon, and that losing weight does decrease the incidence of cancer. It's something we've talked about, but not really demonstrated that losing weight can decrease the incidence of cancer. And this is an article, first article I've seen that actually demonstrates the fact that this intervention is a situation. Dr. Perez?
So that sounds like we should be paying, insurance should be paying for weight loss drugs for obese patients because we would then be penny wise rather than dollar foolish, correct?
Thank you for sharing. Yeah, it makes sense. Makes sense. Not going to happen, but anyway. Yeah. But anyway, I thought this was an interesting study because you don't see, we talk about it, but you don't see studies that demonstrate it in action. This is an article that shocked me that all antibiotics or IV, had the same result for severe pediatric pneumonia. I don't know, Dr. Perez, if you had uh, any experience with this oral and IV antibiotics having the same results, because often we put patients in the hospital to give them IV antibiotics. But this article is suggesting that Whether you did it IV or not, they had the same consequences. Any thoughts, Dr. Price, or any comments?
So much of it has to do with, for me, with the reliability of my parents and
Yeah.
their ability to follow through on providing the medication in the manner that it was prescribed. Similarly to what we did with MMR, for those people whose life is too difficult, we bring them in the hospital, give them IV antibiotics. We know that the children are being treated because we can't address many of the social issues that make it difficult for parents to be compliant.
Thanks for sharing. A very good point. Yeah. Yeah. Okay. Let's go to the next article. And this is something I didn't know either. That severe eczema doubles the shingles risk, and shingles is nothing to play with. And the fact that you had eczema, I didn't realize that that doubled the shingles risk. And this study, an UK study, found that association, which new to me. Uh, Atopic dermatitis is a dermatitis that's associated with allergies. People with asthma and other things have that kind of dermatitis. And this then is associated with double the shingles risk, of course. Those who take the vaccine don't have to worry about it, but those who don't and who have atopic dermatitis do. Any comments about this? Any of you have atopic dermatitis? Uh, be sure you take that shingles vaccine if you do.
Dr. Callender, for some reason I thought that shingles was related to chickenpox
It
as a
is.
child.
It is. It is.
So how is the dermatitis also related to chickenpox?
No, but for some
Hmm.
reason, those who have atopic dermatitis have shingles more than anybody else. Why? This article does not go into, but this is
Hmm.
just an observation. I think now that they make this observation, they have to look into it and find out why. The atopic dermatitis population is a population of people who have asthma and autoimmune kind of diseases, and why shingles is more common with them. Uh, we don't know yet, but I think that's f worth studying. But theoretically, they don't. One does not have anything to do with the other, as far as we know. But I guess studies uh, that need to be done will perhaps find out why there has been this association, which had not known before reading this article. This is an article that I became familiar with when I had a one of my transplant patients who had breast cancer and was treated with radiation and developed heart disease. And after cardiac surgery, her heart would not function anymore, and it was because of the chemotherapy they used for treatment of her breast cancer. So the cardiac effects of cancer therapy uh, need to be uh, more more physicians need to become aware of it so they can use the medications that they recommend in this article so that the heart disease is more treatable. But there are a number of of cancer medications. They talk about them, the 5-FU and fluoropyrimidines and platinum agents that affect the heart. And this injures the heart muscle, and as such, they need to be on medications and be followed by a cardiologist. Uh, Otherwise, as they age, uh, the so-called tsunami effect of the cancer drugs and the toxicity on the heart becomes a fatal cause for some of these cancer patients who die from the heart disease. So it's just something, if you a cancer patient, that staying in touch with your cardiologist and making sure that you get that follow-up is important, particularly depending upon what kind of cancer treatment uh, you received for your cancer therapy. So it's something to become aware if you are a cancer patient and you've had cancer treatments. That cardiac toxicity is something that can be a side effect that needs to be taken into account as you age. Any comments or okay? I think we'll do one more article. This is an article that identifies the fact that high protein does not affect kidney function, does not cause kidney function to decline in middle-aged or older adults. There was a time when we thought you needed to reduce the protein intake of kidney patients. We're now recognizing that that is no longer the case, and that protein intake is not associated with decrease in kidney function, and that protein intake can remain the same. This is done in a number of locations. This is outside of the United States, but something that has been done in the United States as well. Maybe we can do one more article. We have one left. Oh, you got a whole lot of them. This is an article that talks about the importance of uh, weightlifting and recognizing that you don't have to lift a whole lot of heavy weights, but you do have to continue lifting so your muscles can expand and grow, because as you age, your muscles decrease. And so weightlifting and exercises that use resistance keep the muscles from breaking down. And so even if you just use 5, 10, 15 pounds, uh, that you can't be too old to lift weights. You just lift lower amounts of weights, 5, 10, 15 pounds. Uh, and this resistance exercise is very good for you. And that uh, you don't have to lift 50 pounds, but you can lift 10 pounds, 5 pounds, 15 pounds. And there's no age at which you cannot do uh, weightlifting to increase your muscle mass, because as you age, your muscle mass decreases. And the older you get, the more important the exercise and weightlifting becomes. Any comments or questions about the Pearl? Pearl, you had a comment?
Unmute yourself.
Okay, anybody else have any comments about weightlifting and
Okay, I finally unmuted myself.
okay.
Uh, okay, this is just something I wanted to share with everybody. A couple of weeks ago, I had a doctor's appointment, and at that time, my doctor removed me from my blood pressure medicine. This is medicine I had probably been taking in some form or other, probably for the last 50 years. And I just wanted to thank all of the participants uh, from this group because I'm sure a lot of the information that I have gotten since I joined this group from the articles and all the participants and all of the information have contributed to me being removed from a medicine that I have probably been taking for the last 50 years. So I just wanted to say thank you to everybody. And also to the participant who mentioned that her aunt was still going to the gym. I do not still go to the gym, but I do the chair yoga exercises.
Wonderful,
And
wonderful.
I do that. And also, since I'm doing all of that, she mentioned her aunt was 90 years old. I'll just mention that I will be 88 years old on Sunday.
Wonderful. Congratulations.
So, and my
Happy birthday.
Yeah, happy
Happy
birthday.
birthday
Wonderful
to
way to
you.
close this session.
Happy birthday, sis.
Happy,
thank you. Thank you to
Congratulations.
everyone, and
Thanks
thank
so
you for
much.
all the information and input, because I'm sure that has helped me get off of that medicine.
Happy birthday.
And losing the weight.
yes.
Yeah,
Yes, all
all
of
of
it.
it. All of it has helped me get off of that medicine. And
Amazing.
I'm actually feeling better.
Wonderful, wonderful.
That's good.
Okay. Well, education is power, so we're thrilled to get that feedback. Carol, any closing comments?
No closing comments. Just glad to have everybody on. And the contribute, like Betty was telling me, they're not eating anything after 6 and going to 4. That does work. I don't know why or how. And after a while, you're not eating as much. But thank you, Betty, and all of us. We're adding a lot, and even and with Dr. Callender leading us with the articles. I was going to say something about, we were talking about walking fast. And what if you're with a group of people and they're walking all slow? And I'm finding myself getting tired. It's bad manners, I guess, to walk off and wait till they catch up. Or what do most of you do when you're with a group of people and they're walking so leisurely slow, and I'm getting tired out by trying to stay at a slow pace with them? Anybody else have that problem?
Walk in front of them and tell them to keep up.
Yeah, my son is overweight, and it's hard for him to keep up with me if I'm walking fast. So I'll just slow down with him.
No, tell him to stop eating after 4 o'clock. I
So
just
yeah,
wanna,
I
I just
had
want to say right now, I weigh every 1st and 15th to make sure I don't overdo it. So on the 15th, I weighed 134 pounds.
Wonderful.
Congratulations.
And
Congratulations. Good.
I at one time, I think when I started when Dr. Callender mentioned not eating after 4, I think I must have been about 170 some pounds.
Wow.
And I'm 134.
That's amazing. Amazing.
Yeah.
Mark, you had a comment?
No, it was just about the walking for my mom with the group. I I would tend to think that it's okay to be selfish about your personal health goals. So you can split the two. If it's about spending time with the group or with family, you could do that separately. But when it comes, me personally, I wouldn't sacrifice my health goals for the group. I spend time in another fashion, in another way, if that makes sense.
From son to mom. Okay, thank you all, and God willing, see you again next week.
Be safe, all.
Okay.
Yes.
Bye-bye.
Thank you.
Sure.